Welcome back to Great Day St. Louis. For this week's My Mom Club segment, I wanted to focus on something that all women think about as they age: breast cancer. October is Breast Cancer Awareness Month, so now is a really good time to learn more about it. And we are thrilled to be joined by Stephanie Clawson, a nurse practitioner at St. Luke's Breast Care Center, for this segment sponsored by Premier U. It's good to see you, Stephanie.
Thank you for having me.
This is so important because just over the last few years, it seems like some guidelines have changed. So what are the recommendations right now for breast cancer screenings?
Yes, so we follow NCCN guidelines. We recommend that women begin yearly screening mammograms at age 40. The biggest advantage of this is early detection. So when we catch a breast cancer early, we have the best chances for a successful curative treatment.
And then let's move into an increased risk. This is something I think women talk about,
right,
whether with their practitioner or just out when we're discussing other things. Who is at an increased risk for breast cancer? And then also, how do their screenings change?
Yes, so women who may be at increased risk include women who have a family history of breast cancer or ovarian cancer, women who've had a biopsy showing atypical or high-risk features, those who may have had genetic testing showing a genetic variant that increases risk, and then also people who've undergone what's called mantle radiation, radiation to the chest between ages 10 and 30. So if you're at an increased risk of breast cancer, we typically recommend supplemental screening. That's often done with breast MRIs in addition to yearly mammograms.
And does that start at age 40 as well, or is it younger?
Yes, so that is really individualized based on the age of the youngest diagnosis in the family, and just various factors. So that's kind of shared decision making between the patient and the healthcare provider.
Something in just the last few years I've read a lot of articles about is dense breast tissue. Yes. What exactly is that, and how do women find out if they have dense breast tissue, and what does it matter with screenings?
Yes, so on your mammogram report, it will let you know what category you're in terms of breast density. So having dense breasts simply means that you have more of the glandular tissue and the connective tissue as compared to fat in the breasts. So it's very common and it's normal. It's just that it can make detecting cancer a bit more difficult, and it also can slightly increase risk for breast cancer. So we recommend women with dense breast tissue undergo yearly screening mammograms at baseline. Those that have extremely dense breast tissue may benefit from supplemental breast imaging, oftentimes with MRI. That's based on the most recent NCCN guidelines.
And you would find out you have dense breast tissue through the mammogram initially.
Exactly. Through the mammogram, it'll state it on your report, and then we always encourage women to meet with their healthcare provider, have a formal risk assessment so that they know where their risk falls. And then in addition to the additional screening, also talking to their healthcare provider about ways to decrease risk of breast cancer.
So let's say a woman turns 40, has her initial mammogram, no dense breast tissue, no increased risk for breast cancer. How often does she continue getting mammograms moving forward?
Yes, so that's kind of a gray area in terms of when to stop. It's really shared decision making. It depends on the woman's kind of their preferences, but also their overall health. And so there's not a certain age that we recommend discontinuing mammograms. Typically, if a woman has, a 10-year life expectancy, then we recommend continuing mammograms as long as they would want treatment for anything found.
Thank you for being here today.
You're very welcome. Thank you for having me.
Important topic during, as you know, this Breast Cancer Awareness Month. And if you would like to get in contact with the St. Luke's Breast Care Center, head to stlukes-stl.com or call 314-205-6491. My Mom Club is sponsored by Premier U. You can give their South County location a call today at 636-492-5433. If you're on the Illinois side, you can call 618-750-5433 for their Swansea location. You can also find them on the web at premierumed.com.
Oh, ladies, I'm so glad you had that conversation because I feel like we hit all the important questions that everybody's been wondering about.
Hard to keep up with this stuff.
Yes, it is.
Constantly changing, which is a good thing. We're learning more about it. We're getting better techniques.
But so you got to stay on top of it.
Right.
Thanks again, ladies. Coming up.